New York City Health Department has just released information on a Legionnaires' disease cluster in the Bronx. 4 cases have now been confirmed since May 9th in the Highbridge neighborhoods in the zip codes 10452 and 10456. Doctors are waiting for test results and several other people. So far, no deaths have been reported. People with flu-like symptoms, cough, fever, or difficulty breathing are urged to contact a doctor.
Well, the City Health Department investigating a cluster of Legionnaires' disease in the Bronx. Several people now hospitalized and 1 person has died.
Sharon Crowley has more now from the Highbridge section of the Bronx, where local leaders are trying to alert people living in that area.
Bronx Borough President Vanessa Gibson and her team handing out flyers alerting Bronx residents about a Legionnaires' disease cluster in this area.
What we're doing is educating residents, older adults with heart disease, underlying conditions, respiratory issues, those that may have any flu-like symptoms, to seek medical attention immediately.
The New York City Health Department says 1 person has died and 19 people have gotten sick from Legionnaires' disease, which causes flu-like symptoms. Some are being treated in the hospital.
You cannot get Legionnaires from human contact. It is essentially where you're breathing in the vapor in the air, right? And so that's why it's important that we identify the cooling towers.
4 cooling towers in the Highbridge neighborhood tested positive for the bacteria that causes Legionnaires' disease. All have been ordered to disinfect those towers. The city health commissioner releasing a statement saying, in part, most people exposed to the bacteria do not get sick. Legionnaires' disease can cause severe illness or be fatal in those at higher risk, including people with pre-existing chronic health issues.
Legionnaires' disease is a pneumonia or a pneumonia-like illness, sometimes a flu-like illness caused by a bacteria that lives in water-based systems.
Because Legionnaires' disease can be so serious, even deadly, health officials are urging especially senior citizens to go to the doctor immediately if they experience flu-like symptoms. Sharon Crowley, Fox 5 News.
Currently, about 10 people who've been diagnosed with the Legionnaires in the Highbridge section of the Bronx.
Councilwoman Althea Stevens represents much of the area that the City Health Department is investigating for Legionnaires, the zip codes of 10452 and 10456. Legionnaires is a bacteria that grows and spreads in cooling systems, namely water towers, which health officials are currently testing.
The water is still safe to drink. This is not any issue with any plumbing systems within any of the buildings or complexes, but this is us just taking extra precautions to make sure that this is not an extended outbreak.
Those precautions include putting up flyers in possibly impacted areas. That's a crucial step because
it can be tricky actually to differentiate COVID from Legionella, and the symptoms can be very, very similar.
Dr. Nima Medjlesi at Northwell Staten Island University Hospital says doctors can most easily tell the difference between COVID and Legionnaires with a chest x-ray. He says particularly if you have a cough and fever and test negative for COVID but are living in the sections of the Bronx under investigation, consult a medical professional, especially if you're older or immunocompromised.
Legionnaires is not a death sentence. It's very treatable. But I think the most important thing is if you have signs and symptoms, certainly get evaluated by a physician as soon as you can.
This is not unheard of either. The health department says between 200 and 500 cases are seen in the city each and every year. There are generally clusters that pop up when it turns warm because that's when those cooling systems ramp up and the bacteria starts to spread throughout various apartment buildings. Live in the Highbridge section of the Bronx, Henry Rossoff, Pix 11 News.
1 person is dead and 18 others have become sick after an outbreak of Legionnaires' disease in the Bronx. An investigation is now focused on a cluster of cases in the Highbridge neighborhood and bordering communities. The health department reports 4 cooling towers in the area tested positive for a bacteria that causes Legionnaires. The agency says 8 people have been hospitalized so far.
The main thing that
Dr. Ann Shuckett is the director of the CDC's National Center for Immunization and Respiratory Diseases. She joins me now from Atlanta. So tell me, first of all, what does this do to the body?
Legionnaires' disease is a form of pneumonia. It can cause fever, cough, difficulty breathing, and other complications. It's one of the more severe pneumonias, and we think between 5% and 30% of people who develop Legionnaires' disease can have fatal infections.
And how widespread is it? I mean, that 4,500 number is probably not something people are familiar with.
Well, actually, we think there's underreporting. So based on some studies that we've done, we think there are probably between 8,000 and 18,000 cases of Legionnaire's disease each year in the United States. Many of them don't get diagnosed specifically. They're just treated as pneumonia. And even those that do get diagnosed may or may not get reported to the public health authorities.
And how is it spread? I mean, in this particular case, we've been focusing on cooling towers, but what's the more likely mode or most likely modes of transmission?
Well, it's really important for people to know that Legionnaire's disease is not spread person to person. Many kinds of pneumonia are caused by bacteria that are spread person to person, but Legionnaire's disease is caused by inhaling mist or vapors that have the bacteria in them. The Legionella bacteria that causes this pneumonia is found in the environment. It can be found in fresh water, but it can also be found in water in the built environment. And when the bacteria grows to high levels and is blown around through mist or aerosolization, people can breathe it in. Most people who come in contact with this bacteria don't get sick, but the disease is particularly a problem in people who are smokers, people who have chronic lung disease, people who are elderly, or people who have other medical conditions that weaken their immune system.